Hi, my name is Kayla Fonner, and I am the speech-language pathologist at MIHS and McDowell High School here at Mill Creek Township School District. I'm going to be talking to you a little bit about speech-language pathology today. This is my first year at Mill Creek Township School District, so thank you so much for having me. I'm very excited to talk to you about speech therapy. I think it is an excellent field, and I'm a little biased because I love my job, but I hope you leave this presentation with some more information on being a speech therapist, and hopefully maybe some of you will want to be a speech therapist as well. So I'll start by talking a little bit about myself, giving you some details on me, just in case if you have any questions in the end, you're able to know my background, and I can hopefully fill you in on any of your questions you may have. But I moved to Erie in 2019 from Pittsburgh. So prior to moving to Erie, I've worked in several different jobs. I had a few full-time jobs as well as a full PRN jobs, which is kind of part-time jobs. So I'll start with my full-time jobs. I have worked in a private practice, seeing individuals from typically my clients were like preschool age, but I have seen some older people as well. And then I moved to early intervention, uh, 3 to 5, and that was going in preschools, daycares, and homes. I moved to a special education school district. Basically, all of the students in that district, or not district school, I should say, special education school, most of the students were had some sort of severe impairment that they were unable to have their education at their home district. So I worked there, and then I also worked for a regular education school district as well. When I moved to Erie, I worked at the Achievement Center for a year in their Birth to 3 program, and then now I'm here for Mill Creek Township School District, and I'm very excited to be here. In terms of my education, I graduated from Teal College with a bachelor's degree in communication sciences, disorders, and psychology, and then I graduated with a master's degree in speech language pathology from Edinboro. A lot of people ask me if I like my job, and my answer is yes, I love my job. And I hope that shines through in my presentation today to you guys. So, what is a speech language pathologist? Also known as an SLP. We're basically an expert in communication. We treat individuals in a variety of areas. We look at social communication, so just overall social skills. Can a person have a conversation? People, especially those who are on the autism spectrum, have some difficulties kind of having some conversations. So focus on a lot of topic maintenance and being able to start a conversation and end a conversation, and that kind of thing. So we focus on that. And then we also work on speech sounds, which is something that you guys probably are what you think of. A lot of people think of when they think of speech therapy, it's just being able to articulate certain sounds. So can you say your sound, and then be trying to teach you to say it. We also focus on language. So, working on answering WH questions, or maybe working on improving some vocabulary. Language encompasses a lot. So there's a lot of different things we can work on with language and talk about. Voice is another thing. So sometimes people will come to us with some sort of voice disorder, and the speech therapist try to give some strategies to help with that. Fluency, and we work with people who stutter. So we give them strategies to kind of help them through those moments of disfluency. We also work with feeding and swallowing. So looking at can the individual swallow safely? What kind of things do we need to do to kind of alter the diet to make sure that they're, swallowing okay and not choking? We also want to make sure we're looking at, giving them strategies to help them swallow safely if we need to. And the last one is alternative and augmentative communication. So we are looking at some people can't communicate using their words, so we have to get them some sort of alternative communication, whether it be through the use of an iPad. And you might have seen some of your peers and classmates at McDowell or MIHS using a iPad or some sort of device to communicate. We also use pictures or just basic like boards, core boards that we can use with people as well. So in the school setting, typically social communication, speech sounds, language, and alternative augmentative communication are the main ones that I see in with my students and work with them on. There's some fluency, but not a ton. yeah, those are kind of the main things that I'll focus on. So how do I become an SLP? I'm sure you're all dying to know. To be an SLP, you need a bachelor's degree followed by a master's degree in speech language pathology. A bachelor's degree is a 4-year program. Typically, you can get a degree in communication sciences disorders, which is what I got, or you can get one in speech language pathology as well. Um, you also need a master's degree, which is a 2-year program, which includes some clinical practicums. These are typically done through your program, so it's not anything you need to do on the side. This program just kind of works with you to get that set up. Following completion of your master's program, you'll need to complete a clinical fellowship year. This is a paid year, but it is supervised, so it can be sometimes difficult to get a job, honestly, just because somebody has to be willing to supervise you through the entire um, length of the clinical fellowship year. And it's actually 9 months, it's not quite a year. Um, and typically pays a little less because you're not certified yet. Um, and then you also need to pass an exam in speech language pathology. And then once you do those, you can apply for a certificate of clinical competence and state license. Um, and the state license and the CCCs are something that the speech therapist gets so excited about. So I was super excited when I got my CCC and L after my name. So yeah. So where can SLPs work? Obviously, work in a school. We can work in a long-term acute care facility. Um, we can also work in um, skilled nursing facilities, which are basically like nursing homes or rehab facilities. We can also work in colleges and universities and be professors. We can go on to get our doctorate. And typically, those people who have their PhD will be the professors. Um, I do not have my PhD, um, just have my master's degree. And then you can work in hospitals, you can work in early intervention, birth to 3 or 3 to 5. And then you can also work in a private practice as well. And although we all work in different settings, we all have the same amount of communication. So we all, or the same amount of certification. Some setting, no one's certified any differently. We all have the same CCC after our name. Some settings, like a hospital or nursing home, maybe require additional training, but for the most part, um, like for instance, you might need some additional training in like swallowing training if you're in the hospital. Whereas in the school, I wouldn't be working on that, so I wouldn't need that training. But we're all the same certification. So if you want to become a speech therapist or a SLP, start looking for colleges that have speech language pathology or communication sciences disorders as a major. Make sure the school is accredited whenever you're looking, and ask to observe a speech therapist as well. Whenever I was in high school, I had the chance to observe a speech therapist in a neighboring district, and it was so helpful to just kind of be able to see what she did. Was it something I wanted to do? A lot of times, those in the education, like school settings, are very open to letting people come and observe. I would be open to coming to observing me. um, but yeah, it's something that we all know that we need to learn from somebody. So usually everyone's pretty nice about trying to get people to come in and observe. Hospitals, especially like nursing homes, especially with COVID right now, might be more challenging, and maybe other places as well, like private practices and whatnot, just because of COVID. But it doesn't hurt to ask if you want to try to observe in a particular area. So, why is being a speech therapist or SLP so great? We work in a variety of settings. I have had, like I said, so many different jobs, and I just have one certification. I didn't need to do anything differently. Um, and you don't need to stay in one particular setting your whole career, which is awesome. Now, it does benefit you to stay in one particular area, just because you can become get more knowledge and be more of an expert in one particular, um, you know, area of communication versus another. Um, but it's nice to be able to have that variety. There are so many opportunities to expand on your career and develop your skills further. We are required to have professional development, so that's something that we need to be able to do. So I have to do it. I think it's every 3 years you have to complete, or every 2 years, something like that. You have to complete so many, I think 30 hours of continuing education. There's a lot of free opportunities, so that's nice. But that's in order to maintain my state license. I think state license is a little different in terms of hours, but to get my CCC and to keep that, I need to have the 30 hours. You get to help people communicate. I mean, we communicate on a daily basis, and it is the most important thing that you could do in your life. Is you have to be a good communicator in order to be successful. So I get to help students do that on a daily basis, and that is really cool to me. You see progress and growth with the people that you work with, so it's a very rewarding career. You have the opportunity to build great relationships with the clients that you work with, and you can work with collaboratively with many professionals. So it's very awesome. Um, it's just very great field to get into. Like I said, I'm partial because I like my job and I work with so many awesome people. So so yeah, I hope you think it would be great too. So that's all I have for today. If you have any questions, please feel free to email me at fonner@mtsd.org. Hopefully, I'll hear from you. I would love to and hear from you and answer any questions you have in regards to speech therapy. But it's been great to talk to you today, and I wish you luck in figuring out what you want to do after high school.